So I'm assessing her head. It's symmetrical. She already told me she didn't have any migraines or anything like that. And back to her skin. There's 3 risk factors for breakdown would be moisture, nutrition, and mobility. So you're pretty mobile, right? You can get around on your own, and you eat pretty good. And then you're never like wearing wet pants all day, are you, or anything like that? That could cause breakdown? No. Okay, good. All right, so we are gonna, I'm just looking at her nose right now. It looks symmetrical, it's midline. All right, we're gonna check your nasal patency. So I want you to occlude one nostril, breathe in and out, and then again. Okay, and look up for me a little bit. And I'm just looking for a deviated septum. I don't see anything like that. And now we're gonna do her eyes, okay? So her pupils look about 4 to 5 millimeters, okay? And you just look straight for me. And I'm just gonna assess your reaction. Good. All right. Okay. And now I want you to, I'm gonna hold my finger, look up at the ceiling. Now look at my finger. And one more time, look up at the ceiling, my finger. Good. So we're doing Perla. She had, we did her size, pupils. We did, she had equal pupil reaction on both sides. They're round and accommodated to when she looked from the ceiling to my finger. And both were reactive equally. Okay. Have you had any problems with your vision? Do you wear glasses or contacts?
I wear glasses.
Good. So we did your nasal, we did your eyes. Let me just take a look at your ears, your turn. So her earlobe looks symmetrical. It's in line with the corner of her eye. Okay, I don't see any drainage or pus or anything like that. And let me just take a look at your other one. So yeah, symmetrical. And did I ask you if you're hard of hearing?
I'm not.
You're not hard of hearing. Okay, good. And if you'll just kind of lean back for me, I'm just going to take a look at your throat. My hands are kind of cold. So trachea is midline. Doesn't look abnormal or anything. And I'm going to assess for JVD. So her head of the bed will be at 45 degrees. Okay, so we're going to pretend 45 degrees. So turn your head that way. Lean back just a little bit. I'm just looking for JVD. No distension on this side, and look at the other side. And no distension on this side. Good. So that is our head, ears, eyes, nose, and throat assessment. Okay. Where did my stethoscope go?
The stethoscope is over there.
Over there. Where? Anyways. Okay. I want to inspect the oral mucosa real quick. So just open your mouth for me. Lean back. So no swelling. She looks like she has pretty good hygiene. Tell me about your hygiene routine. You brush your teeth and floss. Good. Do you have any cavities or loose teeth or missing teeth?
Why I got some pulled.
Okay.
Yeah.
All right. And have you had any drainage or like is your throat sore, anything like that? Good. So neurological, we've already assessed her level of consciousness and orientation. She definitely on the GCS scale would be a 15. Have you ever hit your head or had any brain injuries? Okay. All right, so I'm now going to move to your cardiac and respiratory. All right. So I'm going to start in the right upper lobe and just breathe regular. Good. And then I'm going to move to the left upper lobe. And then I'm still on the left upper lobe. And then the right upper lobe. Alright, now put your right hand on your left shoulder. So now I'm listening to the right middle lobe on the lateral side. Take a deep breath. Okay, now switch hands. And then this is the left upper lobe, lateral. Good. And now I'm going to do posterior breath sounds. And I'm starting with my left upper lobe. And then the right upper lobe. And then we're going to go down to the right lower lobe, posterior, and the left lower lobe, posterior. Have you had any coughing anything up, sputum like that, shortness of breath?
Nope.
All right. I have to show you this incentive spirometer, okay? It's to help take deep breaths and clear mucus, okay? And you're just going to do 10 breaths every hour while you're awake. And then another technique we have is called turn cough. Turn deep breathe cough. And you would turn your head to the side, you would take a deep breath in, and as you're coming out, you're coughing. Okay. I want you to do that every 2 hours. Do you take treatments at home, breathing treatments, anything like that? Good. All right, so now I'm gonna listen to your chest again. I'm gonna do your cardiac assessment for the heart sounds. All right, so I'm gonna start with my second intercostal space, and this is the aortic area on the right side. It's still in second intercostal space. On the left is the pulmonic, and then third intercostal space on the left is the Erb's heart. And the fourth intercostal space is the tricuspid area. And then I'm going to go down to my fifth intercostal space. Can you lift your breast up? Thank you. Fifth intercostal space, and the little to the left is the mitral area, as well as the apical pulse. And while I'm here, I'm just going to listen in her gastro area, listen for any swishing, which would indicate a gastric aneurysm, and no swishing noted. And if I were to listen to the areas again with the bell of my stethoscope, I would be listening for murmurs.
How does my heart sound?
It sounds good. About a normal rate, rhythm, and depth, okay? Which is good. And now we're going to do capillary refill, so I'm just going to see your fingers. So less than 3 seconds. You got little fingers. Okay. And then I'm looking for edema on either side. None noted. And I'm just going to feel your ankles, okay? Just feeling for edema. No edema. Alright. I'm going to palpate your radial pulse. Okay, she's got a +2 pulse, regular rate and rhythm. And on the left side, the same pulse, +2, regular rate and rhythm. And I'm going to palpate your brachial. Good, +2. +2. And now I'll palpate the posterior tibial radial, so that's just like the back of your ankle. And that's a +2, normal rate and rhythm, regular rate and rhythm. +2, regular rate and rhythm. Alright, while I'm here, I'm going to assess her lower extremity range of motion. So, I just want you to, I'm going to kind of hold your legs up. Alright, now I want you to flex your feet towards so flex up, and I'm going to push against you, good. And then try to point down, I'm going to push against you, good. So she has good range of motion in her ankles and strength as well. Alright, while I'm here, I want you to bend your knees down, good. And then I want you to lift them up, other side, good. And just turn your feet out and in. Yeah, so good range of motion in her ankles and her knees, as well as strength. Excuse me. And now we're going to assess the upper extremities, okay? So we'll do your wrists, so hands out, good. And we're going to do, so this is extension. We're going to do flexion, and then back to extension. Okay, so just stay in extension. I'm going to hold my hands here and flex up. Good, and then go down. Good. And now your elbows. Let me just see. I'm going to feel the joint and just flex in, flex out. Good. I don't feel any grinding or anything like that. Just flex in and out. Good. Alright, we're going to just pretend like exposing your belly, okay? And skin color is normal. I don't see any bruises, any scabs or scrapes, no abnormalities. A few skin folds, normal. And then I'm just going to assess your vital sounds. Okay. Let's see if they're hyperactive or so I'm starting in the right upper quadrant. And then down to the right lower quadrant. And you would want to listen for 1 minute to see how many sounds you get. And then the left lower quadrant. And then the right upper quadrant. Good. So they weren't hyper or hypoactive, they were normal. Okay. When was your last bowel movement? You said it's been what, 3 days? Mm-hmm. Have you passed any gas? Mm-hmm. No gas, no bowel movements, okay. Have you had diarrhea or anything like that in the past, before 3 days? Mm-hmm. No, so this just happened and it's been 3 days. Okay. Any issues with joint pain in your upper or lower extremities? Mm-mm. No. Alright. And then, do you have any trouble urinating? Mm-mm. Have you in the past? No. Have you ever had a Foley? No. Okay. Alright, I'm just going to review the orders one more time to make sure I've hit every section, okay? I think I did. Her respiratory rate was normal, and there was no work of breathing, had a regular pattern. I looked at her oral hygiene. Let me just test your skin turgor, okay? So this will kind of tell us if you're dehydrated or not. I can barely pinch. So it goes right back. It snaps right back. So no dehydration. I already said the 3 things for the brain risk assessment. Okay. Well, according to these orders, that completes our assessment. here.